Hello class, my name is Annex and in this brief video I'm going to be talking about how technology is influencing the nursing field. For starters, technology is bringing us closer. I believe that technology, like anything else in the world, it is what you make it to be. I mean, technology could make us distant. I mean, we could lose that sense of touch and communication of, that we have like this interpersonal communication. We can now talk through phones, email, send videos like this, but sooner or later we're gonna start losing the person touch. If you don't practice it, like any quality, you don't use it, you lose it, kind of thing. Well, on the other hand, I mean, technology could bring us closer. I mean, it brings us closer to a patient. We could send emails to this patient. We could check on the patient, pick up the phone, get a text, or any way you would like to use this technology. In the actually core of nursing technologies, I believe that is improving the safety of nursing, improving the quality, actually making nurses more efficient. Simple example of efficiency will be that if I get a new medication, doctor, prescribe this new medication which I don't feel comfortable, I don't know nothing about. I could go jump in my phone real quick. I mean, I could go on the computer, look this medication up, look the side effects. If I need to do some teaching on the medication, I could learn. I could, do this research and like, empower myself, create more knowledge and more wisdom, which is what we're trying to do in nursing field, and then translate this to the patient, so we can improve the quality of life. Also, nurse, I mean, technology also have the downsides. I mean, we could get used to actually treating the monitor instead of treating the patient. Some nurses just want to look at what the monitor is saying. They're actually not using your five senses, what the nurses used to rely on before, back 10, 15 years ago. Everything was, by touch, by feel, by looking, by assessing. And now our assessment skills, a lot of them come by a machine. We have a pulse oximeter, which is a great machine. The machine tells you how the patient respiration, the saturation, the oxygen in the blood, how much oxygen this patient is actually holding. It tells you a quick pulse. I mean, there's definitely enough information for you to make quick assessments and treat the patient. And also, great portion of technology is, which I use in my clinical facility, was a whole barcode system. Scanning the patient, scanning the medication, and the computer tells you this is the right time, the right patient, the right dose for this patient. And I mean, if the medication was correct, it gave me a check mark saying that all the 5 R's were met. It's a simple way to improve the quality of care. Downsize errors. Also, there's a lot of things that could happen with technology. Now everything is by email, everything's on the computer, so we have to be more careful, more reliable, be more ethical regarding the decisions we make, because the error could be quicker and faster, because everything is moving so much faster. It's making the profession faster, more efficient, and this also bring problems. We could send an email like the ethical case study that I did, the case study number 1 regarding post family and how the email was sent to all the people. I mean, that's a simple example of like, if you're not careful, how one simple thing could become greater. Where before it was sort of like I could pick up the phone call and just call. I know if she didn't pick up, I could put it down, and there was no breach of privacy or confidentiality. But now everything is to a bigger scale, because everything is bigger, faster. I mean, these are little things. Also, the evidence base, it could be improved by technology. We could learn through evidence base, just doing research and finding out what's the newest way, the newest method of doing something, the newest way to like treat a patient. The better treatments, everything could be teach. I could teach a patient regarding anything. If they don't understand, I could bring them to a computer, I could bring them to the phone, I could teach them like reliable websites regarding information, what things to look for, when to call the doctor, what to look at, how to take the medication, how to follow the instructions. I mean, yes, it takes time. Some people are scared of technology, but some other people not. So it's how you use it. I mean, I could get a 16-year-old patient and teach them how to look at a reliable website and read information that they need to talk to, regarding a friend. Oh my God, my friend is a little depressed. I don't know what to do. I could guide them to a reliable website and be like, this is the things that you need to look for. This is the things that you have to assess, how to treat it, what to go about, and I can empower him, and and this this knowledge is infectious, so he will empower somebody else, and so on and so on. So technology is definitely a great tool. It's bringing us closer. As you could see, I'm actually recording this through my phone, and I'm uploading this video. So I hope you like this little short video, and it was a pleasure talking to you guys. Thanks.